Hi, everybody. It's Becca again, and I am now interviewing Michelle. Michelle, would you like to go ahead and introduce yourself?
Hi, good morning, Becca. My name is Michelle Resendez. I am the Franciscan Health Center of Hope Coordinator for Forensic Services here in Northwest Indiana.
Awesome. So we are interviewing Michelle today as part of our 30-day Sexual Assault Awareness Month challenge. And part of the challenge is to interview or honor a hero, and Michelle is definitely one of those in our community. So Michelle, how about you go ahead and talk a little bit about what made you want to become a sexual assault nurse examiner?
Um, Interesting enough, so when I got into nursing, I wanted to take care of vulnerable populations. So my goal was when I entered into nursing school was to become a pediatric oncology nurse. While I was in nursing school, we had a community service component that we were required to complete. One of my colleagues connected me with someone who provided forensic services and thought that it would be a good outlet for me a good fit to be an advocate for rape victims. So I met with the program coordinator. I didn't know anything about sexual assault nurse examining, forensic nursing at that point. I went through their rape crisis training that they had, their curriculum that they had established at their facility. And then you get that first phone call. Like I said, I was in nursing school and I hadn't even started my clinical bedside component yet. So for me to be at the bedside, that would be like my first clinical experience. And I responded to the hospital, and the forensic nurse met me outside the room, and she said, "Okay, I just want to prepare you, just to let you know the patient is okay. It might not be something that you're prepared to look at, but I just want to let you to reassure that she is okay." And she's told me to take a deep breath, just remember everything that I was taught, and I followed her into the room. And I wasn't prepared to see someone. It's one thing to see a picture of someone who has been beaten beyond anything that you've seen before, and it's another thing to see it in person and live, to actually see someone's trauma, to see that pain, that fear, that uncertainty. And so I'm sure my nonverbals then were probably like, "Oh my gosh," but this nurse was amazing. So she introduced me. I went through the motions as far as like with, talking with the patient, being supportive at the bedside. And I was just in awe of how this nurse took care of this victim. She took her time. She was patient. She talked that patient through every step, making sure that she was okay. That was my first experience with trauma and my first experience with trauma-informed care. So after that patient was actually admitted into the hospital.
Wow.
I talked to that nurse afterwards, and I said, "What is it that you do? Like, what type of nursing is this?" And so she explained it to me, and I was just like, I knew at that moment that that's what I wanted to do, and so that's where my journey began.
That's awesome. I love that you were an advocate first. That
Yes,
makes me
you
so
know
happy.
what? It has truly benefited the services that we provide, because I can appreciate how important that service is,
Mhm.
because being an advocate, before I was a nurse, I got to see there's nurses that are very regimented, and sometimes there's that focus on just the kit, and sometimes they forget about that patient that's on that cart that's needing services. So that advocate can really be supportive, and making sure it's a team effort, to making sure that they get that trauma informed care, that compassion, and just making sure that they're okay. Oops, I apologize. My light goes off when it's motion sensitive.
Well, you got to do a little dance. That's all.
I get to do a little dance. Sorry.
So another hat that you wear is one of our co-chairs of our sexual assault response team, which is awesome. Can you talk a little bit about what's the most rewarding part of that for you?
For me is working with a team of people that have the same commitment to victim services, and just understanding that, it's not one person that is making a difference for victims, that it is truly a collaborative team effort, because I'm only one part of the process. So once my patient leaves I always say my four walls and walks out that door, I'm not guaranteed that someone's going to follow up with them. But with my community partners and on that sexual assault response team, we have advocacy, we have law enforcement, we have our prosecutors then on board. So I have confidence in that, you know what, hopefully no one gets dropped through the process, but it just reassures that our community, that there's people that are out there that care about what happens to victims of violence.
Absolutely. And the last question I have for you, Michelle, is if a survivor is listening right now, what do you want to tell them? What do you want them to hear from you?
In regards to where we are right now today with our COVID crisis, I want you to know that there are services that are available out there. We have people in place that are waiting for you to come in to make sure that you get the care that you need. First of all, that you're going to be okay, and that we're going to give you the treatment and care that you need based off of what happened to you, and give you resources, and to make sure that, you know, there's going to be follow through, there's going to be follow up, and that people want to make sure they have a good outcome.
Absolutely. All right. Well, Michelle, I know that you are at work right now and really busy, so I appreciate you taking some time to talk with me today. And thank you for everything you do for our community. Really, we couldn't do what we do without you and our other community partners. So thank you.
Thank you, Becca. And I know we couldn't do what I do at the bedside without with Fairhaven without your services. So thank you very much.
Thank you.